Yes.
Yes.
Yes, we can see your screen.
Okay. So this is something I had to play. Everybody, all of us, that is what we want. It says that is the concept of the logo and the name of our team, because we want Corona to go away and just have our lives be returned to normal. What was it? It was before Corona even existed. So part of our team is existed here, and this is. I'm going to go to the next slide. So what we have built, this is kind of covering the agenda of our presentation. So we will cover the COVID dashboard. It has a self-reporting utility. It has an open essentials utility as well. We have something, a widget which can track flight and case statistics. Our target community is all small businesses and the government and community members, and we'll go more into that. We will talk about our business value, the technology we have used, which is C2M Connect and C2M Workflow. Further on, the team breakdown and how everybody played, what everybody's contribution was, and then we'll go into our future plans. So with that, this is the dashboard, and I'm going to step into the demo. Okay, so this is the dashboard that we built. And right now I have it preset.
I cannot see your screen.
Yeah, I don't think we can see the dashboard. Okay, sorry about that. So this is the dashboard we have built. So it has obviously powered by C2M. We had to put that in there. And the global top widgets will show us global metrics. So as you know, when this whole pandemic started, I have been, or a lot of people I know have been looking at these numbers on a daily basis. So, excuse me. So I have like 25 tabs open, and that is just one browser of mine. So, every day check, how is Dallas County doing? How is Denton County doing? Global metrics and other ones. So I have, what we have is a one-stop shop. So this gives us all global metrics. We can look at, like I personally have family all over the world, so I can look at US, I have other countries, India and elsewhere. So I have to check and see how everybody is doing, because I am concerned. Then we have Texas metrics here. We can also switch to other states, like I think Chris is in New Mexico. So we want to make sure, he will be back with us. So we can check, other states, and whoever has family elsewhere, they can check and see the data. It shows you like how many, also shows you the delta since the last day, what was the number of new cases that were added. We have also provided county data. So this is currently only supported for Texas counties, but that's in our plan for future to add. Office is in Dallas County, so that is what we preset to. But as we know, everybody right now is in the lockdown. So I am right now in Denton County, which seems to be doing a little better than Dallas County. So, so that's good news, Yasser, for you. So I'll still be working on the projects I am. So I noticed this when I was building, looking at this, that the last, from the last day, the numbers are actually better. So we have no new cases. The plus is 0, and since the last day. So that's a good thing. So then this is the metrics. The second thing we can also check by the age bracket. Like if, when this whole thing started, I was concerned, okay, are older people supposed to be more, are more at risk, or are younger people as well? So this provides you a pie chart to show you the age bracket. We also have the gender, confirmed cases by gender, pie chart by that. So this provides you all of that information in one place. And I can now finally close those 25 tabs that I have open in my browser. The second widget that we have is a self-assessment. So we have built a self-report form. And what that basically allows you is you can submit anonymous reporting. So I can go in and I can, anonymously provide information, as if everybody is kind of, some people are scared to provide, even if they, God forbid, were tested positive, or if they have symptoms, people I have seen this, that they are scared. So there is a little bit of fear. What this allows them is to have a self-check of their symptoms and self-reporting if they have been tested positive, or they have been in contact with someone who has tested positive. Luckily, I have not. And then we go through the symptoms. Do you have any of these symptoms? I think everybody has. I had headache a few days back, and I think exhausted. A lot of people can say that this has caused a lot of exhaustion. Then we can select if they are in isolation due to orders from government, or in voluntary or isolation, whether it's smoke or not smoke. And basically all these features allow us to determine in a vicinity, in a neighborhood, how many people are COVID positive or have symptoms. So once I can submit this anonymous report, then I can go back to the dashboard and I can view it here. So this provides you a heat map of what are the total number of people who have self-reported in my neighborhood. Out of those, how many are infected, or how many have been in close contact with somebody who has been infected, and how many have symptoms. So something, which helps you to know how precautious you should be. How many people around you that you need to be watching out for.
So Mary, that form you were showing is the C2M workflow you incorporated.
That's correct. This is a C2M workflow. Thanks to our technology, we were able to put this together in about a week's time, and then with some tweaks while working full time and doing the deliveries for our customers. So yes, this was really powerful, and it was pretty amazing. The second widget which we have incorporated here is the testing locations. So God forbid, if I had, if I was tested positive, or if I had symptoms, there is so much stress and anxiety that everybody has to deal with. So COVID-19, Corona, did not only cause, the health issues to the respiratory system and everything else pretty much, but it has huge impacts on mental health. So now I know, that I have symptoms, or I feel like I have symptoms. I did the self-reporting, so that gives me at least some assurance, but I still want to be sure. So I want to get tested. Now I have to go look, my mind will not be working at that time anyway. So now I have to find out, where can I find testing locations? So this provides an easy way for people, community members, to come in. And like, this is me right here. So I can see around me how many testing center locations are there, what is the nearest one. I can quickly, call them, look for look for details, or I can find out, take an appointment, and I can go and get tested. So I don't have to have delay and search for, try to research where testing locations are available, because personally I had trouble finding that information online easily. So that's another value that we provide. So this is helping community members get some sort of self-reporting, self-assessment, and helping them find a testing center when they do have the need. We have, we built this, a lot of thought was put into building this dashboard, and this is a pure teamwork. So this, every widget had some contribution from everyone. So this one at the bottom, I think this was Ming's idea. So we have to track the flight. It's a flight tracker. So this will provide the government in future, if they get adoption, or airlines, where they can track if there was a flight, that had a positive COVID patient, and somebody, I know Texas governor announced that non-essential travel can be resumed, I think from 24th or something of that sort. So this will provide a safe way where community members can feel more comfortable to travel if they can access that they're, in a particular flight, there isn't any or wasn't any COVID positive patient. So this allows airlines to input their data and accurate data, and it has to be mandated by the government. But as a user, I can also go in and I can look for, if I recently traveled on a flight and I'm scared, I want to be sure I don't need testing or anything. So I will go here, look for the appropriate flight number, search for the flight, and then I can say, okay, I was on this flight. So was that, any positive COVID cases on this flight? So I can check the timing and so on and so forth. So this allows a lot of flexibility. And I will, talk more on the value of these dashboards after I finish the demo. So the last one, what we have. So every one of us is in lockdown, mostly, and we are still working. Thankfully, we are still working and have a means to earn a living. But it is still having deliveries and everything going on, along with this additional stress that the pandemic has caused. We need to live our daily life. And we have to learn new ways, like Rashmi also pointed out earlier. So everybody has to learn new ways of living during this pandemic and living their daily lives and still performing. And so if I'm working, I'm kind of wrapping up like 6 o'clock, 7 o'clock, and then that's my usual hours, then I would want to go have a grocery run. But a lot of times what happened is the grocery stores were closed. They were closed earlier, not the usual time that they used to close. So then, there could be times if I don't have the right, stocked up on the right stuff, then I would not be able to make dinner. It's as a simple essential of life. So what this widget allows you to is allows you to check the stores that are open. It has several categories. Could be grocery stores, pharmacy, gas stations, restaurants, which is a lot of common businesses that we need to, as consumer, go visit on a day-to-day basis. It also allows small business owners to add their business on our platform. So they can go use this form, and fill out their name, their hours of operation, because not only they have to, comply with the government rules during this pandemic, which is also causing a lot of stress, now they don't have to find out ways to advertise, you know, or have traffic coming in, not like, you know, separately, you know, not at one time, but some places have early hours for immunocompromised, you know, elderly or and so on. But there's no one place where you can find all this information. So this allows them to enter their business and business hours, and we show them on the dashboard. Again, this little icon is my location. So I can look at what is the closest grocery store that is open, and I can, you know, I don't have to spend half an hour searching and then not have enough time to, by the time they may already be closed. I can just quickly go to our dashboard here and click on this one. Okay, this is open. It has the hours, and I can make a trip or decide my itinerary. You know, if I'm making multiple stops, I can also do the street view. If there's a person who's bad with directions, as bad as me, so I can check, you know, make sure I have the right location and I'm on the right place. This is probably not the right location, but yeah. So that is our dashboard. Now you can search by categories here. You can have the flight search over here. Searching capability, we have a global search, which allows you to enter a zip code. And based on the zip code, you can also find the testing locations, you know, in your neighborhood, how many people have symptoms. You can see the grocery store, so it filters like all of these widgets based on the zip code. So it provides, there was no one place where all of this information was accessible during when I was looking for it. So that was the motivation to build this to help community and you know, to help people be able to live their normal lives and, you know, not have to deal with some issues which can be resolved by technology. And I will go back to this slide.
So Marine, you are around 18 minutes right now. So I would say use a couple of minutes to wrap up and then let people be asking questions, you know.
Okay, sure.
We want to give judges time to ask questions because last time it was, and also have your team shout out so we can see who all were part of the team. We didn't do it with Zach, but after your presentation, we'll do that quickly with Zach also, so the judges can see the people who are on the team. So
sure. So that was the demo. So this is kind of showing you the business and services portal, which we build, Open Essentials. This is the self-check form and the value it provides. So we can be happy, you know, somebody who's self-checking can be as happy as this girl is after they found out they don't have symptoms. And the business value, this provides a platform to help local businesses in their survival. This provides a central location to local community members to access metrics, global, state and country, current metrics, anonymous symptom self-reporting, approximate cases in their neighborhood, testing center locations, Open Essentials. And this point I want to highlight that we chose a color scheme to reduce the stress levels. You know, we went with the cool colors, blue and green, because you know, we don't want to see a lot of red, and every day we see, you know, a lot of, you know, alarming colors and news. So that's why we chose that. And in future, we could expand to help communities worldwide. Right now, no centralized place to track data, state data other than US. It could also help with coexistence with the virus now that, you know, we are trying to, the governor of Texas has announced and is trying to reopen Texas, you know, to help with the economy. but at the same time, we have to be careful. So this could help us. We do want to reach out to government or airlines potentially to get accurate data for flight tracking. This could reduce spread of the disease and make community members feel safer if they need to travel, and would also help airlines to increase their revenue. If more people are traveling safely, then they can survive as well. Later on, for the self-reporting for the business open essentials, we plan to expand to other categories. This is our team breakdown, and I was leading this. The logo for Gorona was my concept. We listed like all the widgets concepts, and Ajay was doing he created those forms in workflow. A lot of hard work was put in by everyone. So this is a true team effort. We have Khurshid, Yili, and finally, these are big data and, experts, and he wrote a program to get data from public data sources, a lot of data ingestion. And then finally, we have Ming, our designer, and she helped with designing the presentation. We've all been working very, very, very hard. So, so we finally have this dashboard, and hopefully we can provide value and help the communities. And
all right, thanks, Marine. So you did a good job of putting everyone's picture so we can see it. So, and obviously all of them are on the video chat as well. So judges, if you guys want to ask questions, we have approximately now like 8 minutes of time remaining for. And when the judges ask questions, if you guys can shorten your answers so that we are able to get a maximum number of questions in.
Sure.
Anybody wants to start?
Yes, hi, this is Lai. Great job, guys. This is exactly what everybody is looking for. And I do have a couple questions. The data ingestion, I assume that you can ingest not only the current information, but also historical, like, for example, I want to see the people around me, how many of those are vulnerable, for example, elderly, and maybe the nursing home, like in Kirkland, we have a nursing home that started to have problems. We didn't even know that. So I assume that can be overlay, right, in your solution here, so that people like me can be proactively understand what's around me, especially the vulnerable population.
Yes, if the more self-reporting we get, because we are asking if you have been diagnosed with any of the preconditions. So that is one of the questions. So we can have that data for around you if that's.
Yeah. I'm talking about beyond the self entering the information. I'm talking about there's already population information in the survey, and for each city, they have the age, information, so you can overlay those, right? So that
I think you're talking about the demographic data, right? So
that's right, exactly, the demographic data, not the people who enter their information to self-report the issues. So
Yes.
I'm sure that is very easy.
Yes, certainly. If we are able to access that, we can ingest that data via API, or we can add, another tile or category showing that demographics in the same self-assessment map. We can have demographics showing up as well.
Yeah. And then the other thing I want to make a comment was love the widget that you guys created for the flight airlines information. I would like to see the airport information too. Like, there has to be some kind of testing in the airport, and it would be good to have that information integrated. But great job.
Thank you. Yes.
Thank you. Thank you.
In future, we plan to include more transportation, like public transportation, like buses, trains, metros, darts, and everything. So we started with flight, but eventually we'll add more to that.
I love that. Thank you.
This is great, guys. Rashmi, Katz, any questions from you guys?
I do have a couple of questions, but does Katz have a question? You can go first.
Please.
Should I go ahead?
Yeah, please.
Okay. All right. Thank you. Appreciate it. Marine and team, very good job. I think that, you're exactly right. I mean, that's what I've been doing. I've been like looking at so many charts and stuff, and especially because I have family who were traveling, and I have family who's been stranded. So, you know, just trying to figure out where do they need to go, how, where, you know, so it's just been trying to collect data from everywhere. So I love this dashboard that's aggregating, you know, all this information. Is this data real? Like your pie charts, are you going into WHO databases? Like where is this real data? That's my question.
So that was one thing I wanted to cover. Can you see the Newsbreak site that I'm sharing?
No, we can only see your presentation.
Okay, let me.
Yeah, all the metrics and the data is real data, and some of our widgets do show the data coming from the forms which we have given to the community members to fill in. So it's kind of makes this is our major source of the metrics that we are showing on the dashboard.
Right, so like I'm showing the Newsbreak data, I wanted to, this is the actual data. So the cases, number of cases, it's going to be the exact same. And we made sure that that is accurate and there is no delay in the data that is coming on this dashboard.
So this pie chart that you have confirmed cases by age, which one of these is it showing? Is it the global?
So the pie chart, yes. So that one is linked to the self-reporting. So currently, because there is only predictions on the age bracket, like probabilities. So there is no actual hard, you know, data provided for that. So we are using the self-reporting in here for now for the age, based on right now it's searched on the gender. Yeah, if that answers your question.
I guess one other thing that would help, you know, especially a platform like this, which, you know, we wish the our CDC or the WHO website was like this. It's you know, the vector mapping of how the virus spread. You know, an animation of using the data, past data going through, as well as if you can make certain, I mean, you can do that making certain correlations between the data.
That's a great idea, Rashmi. Actually, that's where the AI can come in, right? To show the trend of how it can expand, right, or how it can infect the communities.
Right. Any platform like this, I think, if you have the correlation piece where you can tie in the causality, the morbidity, and you know, the data, and show certain trends, I guess it's a real bang for the buck. I mean, this would be a really good idea.
Yeah, so now we have data and we are getting the data from like different sources, right? So we are already collecting all the data from different like websites like WHO and all those reportings, right? So once we get all the data, we can easily populate all those things. So because of this lack of time, right, we have done all these things, and we highlighted the self-reporting as well because that helps the community. Let's say we are living in the community, right? In the same community, if I don't know like who is infected or who is actually feeling the symptoms, right? So if I have the idea who is actually feeling the symptoms, so I can be a precautious and I can help people like for like groceries or like something like that to be able to, so they can get some help, and I can feel more comfortable that I'm living accordingly and I have the data information.
But wouldn't the self-reporting actually create duplication from the data that provided?
Those are two different things. Self-reporting is actually when you are having the symptoms of something you are reporting. It's not necessary that you are tested actually, but you are just feeling the symptoms and you are waiting for like testing, right? And that's why the idea is testing locations idea is here, where you can go and search. If you basically feel uncomfortable, then you can find the testing location and you can get tested and then you can be confirmed. And as soon as you confirm, government will get the data and they can input the data and we can show that into the graphs here.
So if for the data that you collected, I guess you must have gone to different places. Have you seen that there's a difference in the data
Yeah. There are a lot of differences in like different data sources, like so that because data is really, really random, right? So we are using the data and then combining all those data together to make it accurate. But if you see like different websites, like if you see like there is a one popular data set called John Hopkins. If you see the John Hopkins data set, right? And other data sets, like if you go on like, let's say Newsbreak. So Newsbreak they are actually also aggregating. There are several steps doing like their own work to do it accurate. We did the same thing. We collected the data from different sources, right? And then we aggregated those things to make it like actually accurate. But if you can still see some difference in like different websites, because some people just updating the data every day or something, some updating like every hour or something. So it's like depends on like how they collect the data and how frequently they are updating on the dashboard. That's
all right, Khushi, in the interest of time, you guys, thank you, did a great job. I think you guys need to seriously think of applying some of the OneTech AI engine into this. To do the prediction, which Rashmi gave a very good insight in, like the
deviation in the numbers. If you could put something towards the probability of the correctness of that data, like basically confidence level in the data, just like what you have in your AI.
That's one part we should have built, but because of lack of time, we haven't.
Yeah, we were going to do an AI side, but we decided we don't have enough time for it.
Okay. All right, guys. Thank you very much.